Hi, my name's Stuart Ekberg. I am a conversation analyst at Queensland University of Technology in Brisbane, Australia. I'm a psychologist by training, and a lot of what we study in psychology is in experimental settings and other sort of contrived research settings. And what really drew me to the field that I now work in was that I was given an opportunity to not study people as they operate in an experiment or an interview, but how they actually conduct themselves and behave out there in the real world. And over time, I've progressively moved particularly into studying how they behave and communicate in a variety of clinical settings, which enabled me to understand not only how people communicate in real life, but then by understanding that, I can develop knowledge that has direct application and impact to enhance communication in healthcare. The most surprising thing that I've ever discovered was something that goes completely against the received wisdom around how communication should work. So for the better part of a century, we have thought that death is a taboo. People avoid talking about death. There is a denial of death in contemporary societies like ours. In our study of paediatric palliative care, we don't find a taboo operating. We find people talk about death all the time, but they do talk about it in circumscribed ways. And so by doing so, they demonstrate just how important and consequential the future death of a child is for their family, while also engaging in an open conversation about that to ensure that their child's care is managed as best as it possibly can be. By studying real-world social interaction, we have been able to understand how some of the prevailing assumptions we've made about the way we treat death and dying may actually need to be revised. In the modern world, we know that communication occurs in a variety of cultural and linguistic contexts, so we need to be able to understand that cultural and linguistic diversity. The International Consortium for Communication in Healthcare provides an opportunity for us to understand health communication in that international context. In the world at the moment, we need people who can play nice, whether it's in research and collaborating to develop new knowledge or finding partnerships with clinical stakeholders. If we can't forge relationships based on fundamental niceness between one another, we can't do the good work that we need to do to make changes to patient experiences and outcomes.